My name is Dr. Ian Storch. I'm a board-certified gastroenterologist and osteopathic physician, and you are listening to DO or Do Not. If you are interested in joining our team or have suggestions or comments, please contact us at doordonotpodcast.com. Share our link with your friends and like us on Apple Podcasts, Facebook, Twitter, and Instagram. We hope you enjoy this episode.
Welcome to our 39th episode in our third installment in the Resident Physician series. Today we have Dr. Tara Gaston. Dr. Gaston is a fifth-year orthopedic resident at Rowan University and Jefferson-Kennedy Hospital. Prior to receiving her DO degree at Rowan University, she obtained her master's in physiology and biophysics and a bachelor's at Gettysburg College. She is married to a previous guest we have had on this podcast, Dr. Ryan Moncman, a neurosurgery resident. In this episode, Dr. Gaston talks about what made her choose orthopedic surgery and her journey into the challenges to women in what is historically perceived as a male-dominated field. We hope you enjoy this episode and our others dedicated to Women's History Month. This episode was hosted by Daniella Rodriguez, OMS-III at Midwestern University, Chicago College of Osteopathic Medicine.
Thank you, Dr. Gaston, for being with us today. We're very excited to have you.
Very happy to be here. Thank you for having me.
Tell us what your regular day looks like.
Sure. I get up usually around 4:45. I get ready. I get to the hospital anytime, depending on the day, between 5:30 and 6:30. I sign out with my team, and then we kind of split up and see our patients. And then we head to the OR or the office, and then we technically finish, I guess, around 6 p.m., but obviously if the office day is longer or if you're in the OR longer, you kind of just hang out until you're finished.
Yeah.
Rinse and repeat.
Tell us some of the specific things that you do with your patients just kind of on a regular basis.
Sure. I will see in the hospital, I will see consults, anything ranging from, sprains, strains, hematomas, but more so trauma, falls, car accidents. So they come in and they have a broken bone that either needs urgent care or something we can kind of temporize and then have them see us in the office. So I do a lot of fracture reductions in the hospital. I remember as a student, that was one of the main things that got me interested in ortho to begin with. And then if I'm in the operating room, it depends on what service I'm on. So right now, for example, I'm on sports. So today I was in the OR and we had 2 knee scopes with meniscal repairs. We had an ACL reconstruction. We had a hip labral repair. And then we had a distal biceps repair.
So how much of your day do you spend in the OR versus how much of it do you spend in the office?
I would say we spend 2 or 3 days a week in the OR and then 2 or 3 days a week in the office, depending on what service you're on. Some services like a joints or adult reconstruction service, you're usually in the OR like 3 days a week and the office 2 days a week. Whereas right now on the sports service, I do like 3 days a week in the office and 2 days a week in the operating room. Obviously, as a resident, we like being in the OR a lot more than we like being in the office. But you learn how important the office is.
That's like the surgeon motto, right? If you'd rather be anywhere in the world other than the OR.
Yeah, exactly.
Exactly. So as an orthopedic surgeon, do you see mostly like elective kind of stuff, or do you see acute trauma surgery kind of thing? What exactly is the kind of patient?
So I went into orthopedics, one of the reasons at least was because I wanted to do elective surgeries. I didn't want to be one of those attendings that would get called frequently, after hours and have to go in for emergent consults. So I would say in general, orthopedics is mostly elective surgeries. However, some of the subspecialties such as trauma, pediatrics, even tumor, you're a little bit more on call and seeing a little bit more of those acute injuries that come in. However, as a resident, we see a lot of acute things because we're kind of the first line in the hospital. So we see a lot of acute fractures. So we do a lot of those, the like preliminary work, reductions or setting a patient up for the OR.
So what's your on-call schedule like?
Right now, it's not as bad as it was. In the beginning of residency, it's pretty brutal. You are probably on call every other weekend as a junior resident, working like the entire weekend or like one of the days. And then you're on like once a week, which would be you just take over once the day team comes on. And then it gradually gets easier as you go up in residency. But right now I am doing a lot of backup call. So we go in and help with cases on weekends and things like that. But on average, I think you're working probably like 2 weekends a month.
Well, that doesn't sound so horrible.
It isn't actually. It gets a bad rep. Everyone thinks we're on call all the time and we don't have time to eat dinner with our family or have a life. And in the beginning, yes, it is tricky and it takes work to be able to balance all of that. It's a little bit of a hierarchy thing. So now that I'm a chief, there's a little bit more time, or at least time is distributed differently.
So what do you do like on your off time? What do you do when you get home?
When I get home, usually I'm starving. All I can think about is dinner. I try my best to get to the gym. I used to go in the mornings before work, and then it just gets hard with how early we get up. But I like hanging out with my husband. We kind of make it a point to eat dinner together. So even if that means we're sometimes eating at like 8:30 at night, that's just how our world works right now, and it works for us. Trying to see friends, seeing my husband, working out when I can. That's kind of what I do in my spare time.
That sounds awesome. Your husband is a physician as well, correct?
He is, yeah.
How is that kind of with your work-life balance, having 2 doctors in the household?
It's a question, it's funny. It's a question we get asked a lot. Like, how do you guys see each other? How do you even have time? But the funny thing is we met while we were in residency. I was an intern. He was a second year. We just prioritized our time and like made each other a priority. And I really think that as long as you do that, you can find time to have a relationship.
Oh, that's beautiful. I love it. So we're going to change gears just a little bit right now. Let's talk about kind of your background. So where did you grow up? What was your family like?
So I grew up in Newtown, Connecticut. My family still lives there. My siblings live in New York City, and I am the oldest of 4. So I have an uncle who's a doctor, but otherwise no doctors in the family. Let's see. I grew up playing a lot of sports and competing with my siblings. And we're pretty close family. It's always crazy, and everyone says I talk really loud, and I just blame it on the fact that I've always had to talk louder to be heard in my house.
Yeah.
And the same thing with like we eat really fast. I feel like because we eat fast between our surgeries, right? You try to like quickly eat your lunch. But like I'd say, well, I'm used to that because if you didn't eat fast enough growing up, then your sibling was going to get the second helping before you. So I've been tough for this career.
That is absolutely true. I really feel that firsthand. So you said that you have an uncle who is a physician, but no physicians in your immediate family.
Right. Correct.
So when did you become interested in medicine, or what prompted you to pursue medicine?
Let's see. When I was in college, I went to Gettysburg in Pennsylvania. I went into college thinking I was going to go to law school. So I went in like pre-law, political science, and then I, started my freshman year and I just did not like it at all. I took an anatomy class and all of a sudden I was like, this is so much more interesting. And I just switched gears quickly and did a biology major. And so all through college, I knew I was going to go into the health profession. Being a doctor was up there, but honestly, in college, I don't think I had the maturity level yet to really know what I wanted to do. So I looked at every single option. I looked at physical therapy, nursing, physician's assistant, going into research. And then once I checked all of those out, I was like, you know what? You're going to go to med school. So why, eventually you're going to do it. So why don't you just get it over with? And so then I, studied for my MCATs and applied and did all that I'm sure is all too familiar for you.
Oh, absolutely. 100%. Did you have any sort of experiences during undergrad that really made you decide like, oh, I'm going to do medicine as opposed to the other healthcare careers like physical therapy and whatnot?
Not necessarily one experience, but I actually went to grad school for a year after college, and I did a master's program in physiology and was trying to put myself in pretty much every other career path's shoes, I guess you could say, and picture my life in the future. And everything fell back to becoming a doctor. I think I kind of just wanted to make my own schedule or, be my own boss, or at least have the opportunity to do that. And, looking back now, that's just kind of how that was the right choice for me. That's how my personality is. I feel like I may have been in the, OR as one of the other professions and been like, Tara, why didn't you just go to medical school and be the doctor? So for me, that was the right choice. But I totally understand why others choose the alternative paths.
Yeah, no, definitely. That makes a lot of sense. I really resonate with that. I think a lot of physicians and med students do, I think. So anyway, how did you first learn about osteopathic school?
Actually, in my master's program, we did this, I guess one of the classes we took was kind of all on alternative medicine. And through that, one of the lecturers, or I guess a physician that taught us, he was a DO, and he kind of explained his background. And that's when I first learned about it, was in grad school. And then once you kind of hear about it, then I feel like you see it everywhere. It's just until you kind of first know, you don't really know,
Yeah. So what made you choose to decide to go where you ultimately attended?
I ended up at Rowan. I interviewed at a couple DO programs, and Rowan made me feel like a person and not a number. And it was a pretty easy choice, actually. I had a really, really good interview, just connecting with the physician that I interviewed with. I toured with some of the students, and it kind of felt like a family, as opposed to some of the other places. I kind of felt like I was just a number, like them trying to, pump out more doctors from the school.
So when you applied, did you apply MD and DO or just DO?
Yeah, I applied both. I got waitlisted at one MD school, and then that was pretty much it. And honestly, I thought long and hard about, do I reapply and go for MD again, or do I pursue the DO interviews? And I talked to my uncle about it. I talked to family, my friends, and everyone. The consensus was, you want to be a doctor. Like, being a DO, it's a different mindset in terms of, like whole body, whole person, and in terms of like the philosophy of teaching. But at the end of the day, you're becoming a doctor and you can do everything you want to do. And yeah, I'm really thankful for the path that I guess was somewhat paved out for me.
In terms of being a DO, how did that affect you when you were applying to residency?
It didn't actually make too much of a difference, because there are a lot of DO orthopedic programs that I could apply to. So it really wasn't an issue. I took both the step 1 and the COMLEX just so that I had, the option. But in the end, I ended up just applying to DO orthopedic programs, and that's what made the most sense. So it didn't affect me at all. The opportunity to become an orthopedic surgeon was 100% possible. I know for some specialties it's a little bit more difficult, but in terms of orthopedic surgery, there's plenty of DO programs available.
Okay, that's great. Did you do research while you were in med school?
I did. I think so. When I was in med school, research was definitely something that was encouraged, especially to get into surgical specialties. And I did a couple projects, but I think that the research thing has picked up now that I'm in residency. And I don't know how it is for you guys now, but we get so many candidates now that have just 5, 6 papers that they do during med school, which I just think is amazing. I don't know how you guys have time to do everything that you do now, but yeah, I think if anyone wants to apply to, at least orthopedics, you definitely want to get involved on research projects. And it doesn't necessarily have to be in something that you are going to end up doing in your future. It just, it looks good to get involved in research. But yeah, I did a little bit as a student, but not as much as that I do now.
What was your research on in med school?
In med school, it was, I did it on actually general surgery, which is a twist. Okay. Yeah, I actually chose orthopedics kind of late. So I did my general surgery rotation as a third year pretty early on. And that's when I was like, wow, I really like the operating room. This is cool. I'm going to explore surgery, got involved in research. And then, right before I was going to apply for audition rotation, something just did not feel right. And I talked to like one of the orthopedic program directors and I was like, what are my chances here? I'm switching gears pretty late in the game. And at the end of the day, you have to do what you like. I would have been so unhappy in general surgery. And I am so thankful that I just went for it. I kind of went on a tangent there about the research thing, but
no, it's fine.
Yeah. But I don't know. It was my medical school research was on probably like cholecystectomies, things that I'm not interested in anymore.
It's okay. You gave me a better answer than the question.
All right,
I asked. All right, good. When you say that you would have been unhappy in general surgery, why do you say that?
I think I say that because I'm so happy in orthopedics. So I couldn't necessarily say that I would have been unhappy, but I just think that maybe the lifestyle orthopedics is like the perfect balance of hard work, but everyone's still really personable and, fun and outgoing. Everybody has a pretty strong personality. And not to say that they don't in general surgery. I think it's more so that I just fit in so well with orthopedics that I couldn't imagine myself in any other specialty, like whether it be general surgery or internal medicine or PM&R.
So were you always, I know earlier you talked about how in undergrad you were interested in anatomy and you had thought about, physiology and things like that. So were you always interested in more of like a musculoskeletal kind of field?
Yeah, I was. Yeah, I think, it's so cliche and we all say it, unfortunately, but, we like sports and then we go into orthopedics, blah, blah. But it is a bit true, although not all of my co-residents like sports, surprisingly. But you kind of, part of you, I guess, when you grow up playing sports, you like just something to you, muscles, bones. So orthopedics kind of made sense to me only because I sort of had that background already. And then, totally. It helped having a master's in physiology to then be able to apply that to orthopedics 100%.
So let's dig back up just a little bit. So tell us about your background in sports. What did you do for sports?
Oh, so I would say I'm a soccer player at heart. I played soccer in college, but growing up, I did basketball, did lacrosse, ran track. So kind of a little bit of everything. I recently took up golf and I wish I had started sooner, although it is a very expensive and time consuming hobby. So I see why I haven't been able to in the past. But yeah, that's my new thing is golfing. It's a blast and very frustrating, but I love it.
So you just played soccer in college?
Uh-huh.
Okay. That's fun. I love soccer.
Yeah. Did you play?
Oh, God, no. I am so uncoordinated. It would not go well. Well, that's really good, though, because I feel like that is a very common thread. People who are very athletic do tend to end up in that physical medicine kind of aspect.
Sure.
So with that said, as DOs, we are trained in OMM and osteopathic manipulation. So how, or if you do, incorporate OMM into your practice?
I would say that unfortunately we do not use a lot of our the specific OMM teachings that we learn in med school, but I will say that In terms of like putting your hands on a patient's body and like your palpatory skills, I think we learn that from day one in med school as a DO. And I know that definitely helps. I don't have
Yeah.
too much to compare it to because although, I work with MD and DO orthopedic residents, you don't necessarily like side by side compare yourself. But I know personally, we probably innately just use our hands maybe a little bit better. But sadly, we do not use the techniques we learn in school as much in orthopedics.
Do you ever think that maybe your path would have been better or easier if you were an MD?
I don't really. I don't. I think I speak to, a lot of people about this, and it does sometimes get annoying with, we work with most of our attendings are MDs, and they treat us like we were MDs or DOs. They don't ever bring it up. They don't comment on it. It's kind of been like very refreshing because I've had a really, really good experience here in the New Jersey, Philadelphia area being a DO. And so I don't, really think it has made my life any harder pursuing what I want to be, when I grow up.
Yeah. Yeah.
I just got a really good fellowship here in Philly. I'm the first DO actually in the foot and ankle fellowship at Jefferson. So it can happen. I think if you work hard and you're a good person, and you can do anything.
Yeah, I love that. That's so impressive. The first DO foot and ankle fellowship resident. There's a lot of words in there.
Yeah, a lot of pressure too. But
oh my gosh,
just have to do well.
So let's keep talking about residency just a little bit. Let's talk about the residency application process just in general. How did that go for you?
It went pretty well. You have to get your letters of rec, which I got two from orthopedic surgeons, one from a general surgeon. And then I wrote my personal statement, probably about some cliche about sports and orthopedics. You go and rotate and audition. So I auditioned at 4 different places, and then I think I got 5 interviews. Yeah. I would be happy with they told me like anywhere from 3+ interviews. So yeah, it worked out. I pretty much knew I wanted to go to Rowan for residency, but it was good to go interview around and check out the other programs. It's a lot harder now to get in than it was back then. Because now I'm involved in interviewing new applicants, and your resumes are crazy. It's unbelievable.
Yeah, I feel like it just keeps getting exponentially more difficult. That's what they tell me.
Yeah, and the scores keep going up higher and higher and higher. It's awesome. Good for you guys.
Yes,
you're probably like, great. Good for me.
Yeah, I know. Awesome. I'm so excited. Can't wait.
Yeah.
So you said that you knew where you wanted to go for residency. How did you end up deciding that you wanted to go there?
So yeah, at the end, when I made my rank list, I knew that Rowan was number 1. I did, I went back and forth. I would say the week before you have to like officially submit. And I went back and forth because my thinking was, oh, you just did, med school at here. Do you want to stay and do residency here? Or should you branch out and, see another hospital system? But at the end of the day, the group at Rowan I just like fit in with them really well. They really, really liked each other. And they worked as a team. It wasn't malignant. The experience with the attendings was, the best. We worked with a lot of the like Rothman attendings down here in Philadelphia, which is like a great orthopedic practice. So it was kind of a no-brainer once I like laid everything down on paper. And then, yeah, I got lucky and it worked out for me.
So it just felt really good is what you're saying.
Yeah, I just like had a good feeling. And it's funny because they say in terms of choosing like your specialty, so like I chose foot and ankle, the same thing. They said to have an open mind throughout residency, and once you figure out what you like, it'll be pretty easy. And I went again, me and my choosing late in the game. I went my entire third year liking a lot of things and not necessarily liking, one specific subspecialty. And I was like, not sure what to do. And then I went and did my foot and ankle rotation, and it was like an aha moment. And I was like, yep, this is it. I guess it's true. You do get that feeling. Yeah. So I don't know, I would say you just gotta kind of having an open mind in med school and residency and this entire field is like really, really important, because you might surprise yourself in terms of what you like and what you don't like. And then this is a long field, or long career, and it's a lot of work and time that you put in. So you just want to make sure you're making the right decisions for the right reasons. So.
I don't know if you will know the answer to this, but I'm going to ask you anyway.
Yeah.
So recently the ACGME has merged both the DO and the MD residencies, as I'm sure you're aware.
Yes, we are absolutely, because ours is now a combo MD DO residency.
Right, yeah. So do you feel like this will have any sort of effect on applicants and whether their chances will either increase or decrease?
Yeah, that's a really good question. I have a suspicion that if these, our DO programs, if they open up to MDs and the program director happens to be an MD as well, I think the chances of that program becoming more an MD program than a DO program are pretty high. I think we should, as DO programs, we should try to keep our DO program directors and you don't want to be biased one way or the other. You want the best candidates no matter what. But I think we just have to be careful we don't lose our field a little bit, But I guess that just means as DOs, we need to work a little bit harder to look out for each other, And I think if anyone wanting to get involved in residency education and, as a DO, you want to be a program director, you should.
Yes.
Not me, but everyone else.
You're not planning on going down the education route?
No, I was just kind of joking with you. Actually, I would love to. I would love to work with residents. Being a program director is a lot of work. I see my program director, and he spends a lot of his free time doing things to make our lives a lot easier. But it is a pretty awesome and rewarding job, I'm sure. And I hope to work with residents in the future. I don't know if I'd, be a program director, but I would, definitely like to educate the future generations for sure.
You are a woman, and orthopedics is traditionally a very male-dominated field.
Yes.
So what is like the balance to women to men in your program?
We take 5 residents a year. So a couple of our classes have like one less person. So I think we have 23 total residents, and there's 3 of us that are women. So me in my class, I have one PGY3 and then another PGY2 that are both females.
So, okay.
So it's less than 1 per year.
Okay. So out of 23, there's 3. So how do you think that affects your practice in any way?
As a woman in orthopedics, it's a lot better, I think, than it used to be. I think that people automatically assume orthopedics, it requires you to be like big, strong, and use power tools. And while you do have to be able to use power tools and, do reductions, it's kind of like brains over brawn. Like you can always figure something out without using like all of your strength. It's almost like that work smarter, not harder thing is like really true in orthopedics. There's a way to do everything. So you kind of have to be creative, I guess, in terms of figuring those things out, like specifically in the OR and, with reductions. In terms of it being male dominated in the sense that my day to day, sometimes I just like really wish I had more females around me. All the like farting and poop jokes get really old. But overall, it's not too big of a deal. I love my male co-residents and I love my female co-residents. We all get along equally well. Right. It would be nice to have a few more female mentors, to be honest. I have great male mentors, but I have, fewer female attendings that I work with. Most of the female attendings I work with are those on like out rotation, so I'm only there for like a limited amount of time. And I think that's probably the biggest thing. I think it would be nice to just like hear more from, female attendings, which makes me think in the future I'd love to get involved in something and, be there to help guide future female orthopedic surgeons, because it's just nice to have that female perspective, I think.
Yeah, absolutely. What do you feel like specifically that you could get out of a female mentor as opposed to the male mentors you have?
Yeah. One, I think so, males and females, they think differently, they learn differently, I think they speak differently. So it would be interesting just to see how they feel in general. Like, I guess the best example I could give is, so, there's this like running joke that as, you go into the OR as a junior, and then you come out of the OR and you go to the call room where everybody's hanging out and you're like, man, I just did that whole case. I did that whole case skin to skin, like meaning that your attending, was there, but you did the whole case. So we have our, so you have your like my male co-residents would come out of the OR and do that to me all the time. And I'd be like, thinking to myself, like, wow, I just worked with that attending. I didn't do it skin to skin. Like I did a lot, but I didn't do it skin to skin. And so then you start as a female, you start to be like, oh, am I like not as good as what is wrong with me? And you overthink it a little bit because that's just what we do. And then you find out that that's just not true at all. It's just, that's kind of how boys are. They're just a little bit more confident innately and they like to talk. And so I was actually involved in this like women's trauma surgeon meeting. And basically it was awesome. I heard the female attendings tell the exact same story, that while they went through residency, their like male counterparts would come out and be like, I did this whole case. And they'd be like, what's wrong with me? And now as they're attendings, they like hear the residents do it. And they're like, they didn't do the whole case. It's just the way they kind of like portray themselves. So, I think it would be in that aspect just interesting to kind of like laugh and joke about our experiences and like the way we think about certain things. I think it'd be nice to have a female mentor to kind of talk about the whole timeline and family situation, right? Like things are different for me than my male co-residents who all are having babies right now because their wives get to have the baby. Whereas of course I could, but it just affects me a little bit differently. I have to, I don't want to have to take time out. And that's me personally. But then, there you have to think about age and is there ever a right time? I don't know. Because now, you do fellowship and then you're in the beginning of your attending career. So there's just like a little bit more you have to think about as a female. So it would just be, I think that's the reason why it'd be nice to have a female mentor, just to like pat you on the back and say, it'll be okay. It'll work itself out.
Yeah, I totally understand, because I just personally, like, I really recognize that in myself, what you were saying about how we're so much more critical of ourselves.
Yeah.
I totally see that in myself and in the women around me. And I try really hard to call it out with other women, but I don't do it to myself,
Yeah, 100%. And it's funny you say that, because so like I said, luckily have a loud voice. So when I'm like presenting in conference and our academics and things like that, I talk loud so people can hear me. But some of my female co-residents have just like kind of quieter voices, but everyone just like is like, well, it's she's a female, so she has this soft spoken voice. And she's not confident because she's talking quietly. And I try to like tell my female co-residents, like, you gotta just speak confidently and speak loudly, whether you're confident on the inside or not. You gotta make it seem like you are. And like, again, it's so much easier to say that than do it.
Right. Yeah, absolutely. It's very, very much easier said than done. But I mean, I really like that. I think anybody, all women physicians in general, regardless of specialty, can really resonate with that because, doctors and med students in general are all type A
Yes.
to begin with.
Yeah.
And, type A males are definitely a lot more
Intimidating.
yes, and
intimidating and outspoken. Yeah.
Absolutely. And then for women type A, it tends to just be like an internal nitpicking, as opposed to like an outward expression of our confidence. So
yeah, you're 100% right. You gotta like get thicker skin, and if it hurts, just lock it up and then have a really good outlet. You got to have a good outlet, right? You can't lock that all up and then just bottle it forever. You got to be able to talk to somebody about it or go for a really hard run or, whatever people like to do. It's important to have that outlet too, a support system.
Absolutely. Just a couple more questions.
Yeah.
I was going to ask you mentioned earlier about, the timeline about having a family and children. Was that something that you ever kind of made you doubt going into something like surgery?
It did, which is, yes. So when I applied for orthopedics, I was single. And so it 100% went through my mind. And I think I would bet that every female picking a specialty thinks about it. They may not necessarily make a decision based on it, but they definitely think about it. And I did too. I said, wow, I'm going to be so busy. Will I ever meet anyone? Will I ever have a family? And again, you just have to you can't predict the future. So you just have to take whatever facts you have and take your pro-con list and what you're feeling and use what you have and make the best possible decision and then hope that things will work out. And I knew I wanted to do orthopedic surgery. So I said, you know what, that's what I'm going to do. And hopefully the rest will fall into place or work itself out. And luckily it did. I met my husband as an intern and, we're not quite there yet in terms of having kids, but we talk about it now. And once again, we're at that I am, I guess, at that crossroads of picking fellowship and where to go and all that in terms of family and future. But I don't know. Name a profession where you don't think about your spouse and your other parts of your life. Almost every profession does, and every specialty, it's the same thing. My friend, who's a pediatric attending now, actually, she went through the same thing. She only she didn't want to have a baby in her residency and her fellowship, and she waited till she's an attending. So I kind of think that, it's all relative. It's all the females are kind of feeling the same thing. So whether you go into, primary care or surgery, it's probably a thought everyone's having, but I think life kind of works itself out. There's no, right time, but as females, we'll still worry about it.
Yeah, I know. I was actually going to say I would be curious to know if any of the guys we work with ever think about this kind of stuff because I know it's definitely something that we as women think about a lot, and I would just really be curious to know if it ever even crosses their mind.
Yeah, I don't know, because I have a lot of co-residents right now that all are having babies soon or have a baby, and they say it's tough, but they also corroborate with me and say yeah, this would be a lot harder if we were the ones carrying the child. So, but again, you can make it work, and I would if I was giving advice to any female resident, I would say probably don't make a decision based on that. Just think about it and tuck it away and have it on the, corner of your mind, but make a decision that's best for you and it'll hopefully work itself out.
Can you tell us one thing about you that made you successful? So what do you feel is your personal superpower?
I think that I have a lot of grit, maybe you could say. I am competitive and can just feel like I can do it. I set my mind to it and I will get it done. I give an example. I ran these races across a desert. It was an ultra marathon, and I was like, you know what? I'm doing it. And I just signed up and ran it. And like, I just like mentally told myself, you're going to do this. So I sort of feel like I can just like tell myself to power through, and I can.
What is the best piece of advice you have been given, either, in school or college or residency or wherever, that you could share with our listeners and that you think would give them the most value?
I think that when we have to make a lot of hard decisions in the medical field in terms of making choices for us, making choices for our patients, in terms of, trying to figure things out and what's right for you. The best advice I got was picture yourself in, 10 years from now. And what do you picture? Like, eventually you're going to wake up 10 years from now. So are you going to wake up, as a GI doc in Arizona, or are you going to wake up as orthopedic surgeon in Connecticut? And which of those stories like looks better to you? Because I think it's like very easy to get caught up in like all the excess of medicine, in terms of like, how much money are we going to make? What is the work-life balance in this field? Are people nice? What kind of patients are we going to work with? What are our hours? And all those things are important. But I think at the end of the day, like, you just got to do what's ultimately best for you and like what you want out of life. So I think just like always remember to like look ahead, have goals, and use whatever information you have to make the best decision, and then don't look back. Like, it's probably the right decision, and you just got to have an open mind and go with it.
Absolutely perfect. Thank you so much, Dr. Gaston, for being with us today.
You're welcome. Thank you for having me.
This concludes our episode of Do or Do Not. Send all inquiries, comments, suggestions, and even let us know if there's someone you want us to interview to doordonotpodcast@gmail.com. Don't forget to like us on Facebook at Do or Do Not Podcast for updates. If you enjoyed our podcast, please share it with your classmates and administration. We have plenty of more interviews lined up, and we're excited to share them with you. This is Tian Yu Shea. Thank you guys so much for listening to Do or Do Not.